Hello, this is Mikael Nordfors. This is part 9 in my course in Tendon Attachment Therapy. It's about the shoulder and the chest. While watching the video, we recommend that you stop it between each slide and try to find the mentioned tendon attachments on yourself or a friend. This will literally give you more of a hands-on experience. First muscle is called Infraspinatus. It's a very important one when you treat shoulder problems. The action is to laterally rotate the arm and it stabilizes the humerus. Lateral rotation means you rotate it so the thumb goes outwards. The origin is the infraspinatus fossa of the scapula, and these points are very important. When you press these points, you can often feel that it radiates to the arm, and that's normal. The insertion is on the middle facet of the greater tubercle of the humerus here. You can also press there. But especially these points are extremely important. Then we have the Teres Minor muscle. It has the origin from the posterior aspect of the inferior angle of the scapula, and the insertion is on the intertubercular sulcus of the humerus here. The action is to adduct the humerus, like this, internal rotation of the humerus, bringing the thumb inwards, and it extends the humerus from flexed position, for example, rowing. It also protracts the scapula and depresses the shoulder. Teres Minor has the origin on the lateral border of the scapula, a little bit higher than the Teres Major, and the insertion is on the inferior facet of greater tubercle of the humerus, a little bit below the Infraspinatus insertion. The action is to rotate the arm laterally, bringing the thumb outwards, and it also stabilizes the shoulder joint here, the humerus. Next one is Triceps Brachii. The origin of the long head is the infraglenoid tubercle of the scapula. Then we have two more heads here that will go more in detail in the next lecture. It extends the forearm, like hammering, you use this muscle. And the long head extends and adducts the arm also. Can bring the arm inside, adduction, and extension can bring it backwards also. It also can extend the shoulder. Here we see the long head, where it goes between the teres minor and major muscles, a little bit here under the scapula, and you see a three-dimensional picture of the three heads here. Then comes the supraspinatus muscle. The origin is in the supraspinatus fossa here. Press in the depression between the spine of scapula here and the clavicle, and then deep down you can find the sore point here almost always. This is a very important muscle too, and the insertion is on the superior facet of the greater tubercle of the humerus. The action is abduction of arm and it stabilizes humerus. So you see the action here in a three-dimensional live animation, how it abducts the arm. It's the first part of the movement, and then the deltoid takes over later. And here comes the Deltoideus or deltoid muscle. The origin is on the anterior border and upper surface of the lateral third of the clavicle, here from the front, on the acromion, and on the spine of the scapula. The insertion is on the deltoid tuberosity of the humerus, down here on the side of the humerus, on the outer side. The action is shoulder abduction, going like this, flexion and extension. It can bring the arm both forwards, backwards and sidewards, in simple language. Here you see the muscle from above, three parts here that do three different things, and in a three-dimensional representation. Then we have the Subscapularis muscle. The origin is the subscapular fossa between the ribs and the scapula, on the inside of the scapula. And the insertion is on the lesser tubercle of the humerus, a bit on the front. And this is a sore point in many people. The action is internal medial rotation of the humerus, and it stabilizes the shoulder. Then we can repeat the levator scapula. It's also part of the shoulder muscles. It's here on the insertion, is on the superior part of the medial border of the scapula. And we have seen this before also. The origin is here. It elevates the scapula and rotates it downward by going up here and down there. Here we have the shoulder muscles all together. The three on this picture is the latissimus dorsi muscle, you remember from before, coming from the lower part of the spine. And the Teres Minor muscle is here. The origin is here on the lower part of scapula, below the Infraspinatus. That's number 8. And then we have the Teres Minor here. It's a bit higher up on the side of the scapula, outer side. It goes up there. And then we have the Supraspinatus muscle here, and going there. And then we have the long head of triceps. It comes from here and going down to the elbow. This is a dorsal view from the back of the humerus. You see the infraspinatus insertion on top here, Teres Minor just below, and the lateral head of triceps and the medial head of triceps here. And this is the little where the nerves go down, radial sulcus. Then we have the most famous muscle maybe for bodybuilders, the biceps brachii. The origin is the short head, is on the coracoid process of the scapula. Here, just below the scapula, is little bone here, where you can feel it. It's sometimes hard to find on fat people, but most of them, it's always possible to find. Here you see, this is a coracoid process. The long head is on the supraglenoid tubercle, just above the shoulder joint. And the insertion is on the radial tuberosity and bicipital aponeurosis into a deep fascia on the medial part of the forearm. It flexes the elbow, and it can also flex and adduct the shoulder. And it supinates the radioulnar joints in the forearm, turning the thumb side outwards. And then we have Pectoralis Major. The origin is from the anterior border of the medial half of the clavicle here, anterior surface of the sternum, and the superior 6 costal cartilages, a little bit more inside here. The insertion is on the lateral lip of the bicipital groove of the humerus here. The action is to flex the humerus, move it forwards, extend the humerus backwards also, and adducts and medially rotates the humerus. You use it when you hug people. Pectoralis Minor is the origin is on the 3rd to 5th ribs near the costal cartilages, in the little bit towards the side here, and the insertion is on the medial border of the superior surface of the coracoid process of the scapula. On the middle border is Pectoralis Minor. On the side border of the same bone is the biceps. The action is to stabilize the scapula by drawing it inferiorly and anteriorly against the thoracic wall. It raises the ribs in inspiration also. And then the Serratus Anterior. The origin is from the fleshy slips from the outer surface of the upper 8 or 9 ribs. You can see here on the side of the torso. And the insertion is on the costal aspect of the medial margin of the scapula, here on the inside of the scapula. It protracts and stabilizes the scapula, brings the scapula this way, and assists in upward rotation. Here we have the attachments of the chest. Pectoralis Major, you can see here, is on the breastbone, and also here between the ribs, and also on the little bit out on the rib cartilage here, on top of the ribs, especially the lower ones. Then we have the Pectoralis Minor, you see more to the side here. And the rectus abdominis, you remember from before, this is a very important point, and also a little bit lower here. This is the heart attack point, if you remember. Then we have the humerus, front view, from the front, and the supraspinatus is here. Subscapularis, here, that's the one in the front. And here you have the latissimus dorsi. And here you have the Teres Major. And here you have the Pectoralis Major we're talking about just recently. and the deltoid is here, deltoideus. This is the tendon attachment on the scapula from the back, a dorsal view. A biceps short head here on processus coracoideus. Deltoideus is here. Trapezius here. Teres Minor here. Teres Major here. Infraspinatus all the way here, especially these points. So, levator scapula is here. And the latissimus dorsi is down here, a little bit on the edge. And don't forget the supraspinatus. Here you see the tendon attachments on the scapula from the inside view. And this is biceps, short head, triceps, the long head here. And this is the subscapularis. And the Pectoralis Minor is here, on the inside of the coracoid process. And then Serratus Anterior you can see here, all the way on the edge here.